Today we have the renowned gastroenterologist from Mathura, Dr. Ansul Gupta. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Ansul Gupta is a leading gastro in Mathura, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with liver, pancreatic disease, obesity, and therapeutic endoscopy at Mathura as a senior consultant. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Ansul Gupta to enlighten us on the topic current management of NAFLD and NASH. Sir, over to you.
Thank you. Today on this evening, we are gathered here to discuss about a common topic of liver, that is non-alcoholic fatty liver disease. As I mentioned, I am Dr. Ansul Gupta from Mathura, gastroenterologist. So we'll start the topic of today. Next slide, please. So coming to the first anatomy of liver, what is liver? Liver is nothing but the second largest organ of the human body, which is around 1.5 kilogram and 5% of which is fat. It is located in the right upper portion of the abdomen, that is, and it is above the stomach and the intestine. It is generally pinkish brown in color, which is very soft in consistency, and it is highly vascular. Next slide, please. So what are the functions of the liver? There are many functions of the liver, like liver, as shown in the chart, you can see it is very much necessity for breakdown of alcohol and other molecules, for carbohydrate digestion. It also detoxifies blood. It promotes healing. It is regulates the blood circulation. It has for processing of nutrients. It also destroys the old RBCs. These all are functions of the liver. Next slide, please. Now coming to the understanding of the NAFLD, what is NAFLD? That is nothing but non-alcoholic fatty liver disease. It is nothing but in which there is accumulation of the fat more than 5% of the body weight of the body weight of 5% of the weight of the liver. Means the 5% of the weight of liver, if it is accumulated with fat, it is known as NAFLD. If it is not treated, it goes into the inflammation stage, which is known as NASH, non-alcoholic steatohepatitis. Being overweight or obese, having type 2 diabetes or high cholesterol are associated with increased risk factors of non-alcoholic fatty liver disease. Next slide, please. What is the prevalence? What the prevalence means, how much is there in our population? One out of the four patients have NAFLD regardless of the weight, more than six diabetics, and nine severe obese old patients have NAFLD. Now, generally, what we are seeing is one out of three patients, even the school-going children or urban or rural population, are also having NAFLD. So it is very much common disease. It is nothing but a next epidemic what we are going to see. Next slide, please. So what is this slide is a very good slide which will help you to understand something. This is the left side of the portion of the liver. What you are seeing is a healthy liver. When it is the fat accumulation, it goes into fatty liver. Next, because of the fatty liver, when the fat accumulates, there is inflammation. In inflammation, there undergoes fibrosis, which is known as liver becomes little bit hard. When the fibrosis becomes irreversible, which will cause a scar tissue, which will cause a liver cirrhosis. This liver cirrhosis is not reversible disease. So we are afraid of this because when this liver cirrhosis occurs, we can't have in healing of the liver. So till the fatty liver and liver fibrosis stage, some of the medications we can heal it, but till liver cirrhosis we will not able to heal it. So it is very dangerous disease. Next slide, please. What is what already I have told in this same slide, we are seeing that what is NAFL, that is fat accumulation, and what is NASH, that is fat accumulation plus inflammation and scarring disease, which is NASH is known as non-alcoholic steatohepatitis. Next slide, please. Now, what are the causes of NAFLD? Already mentioned what is the causes. These are the mainly high risk factors. That is, if you have genetic foundation, if you have excess food intake, that is excess of fat or carbohydrate diet, less of physical activity, and being certain medications or what we say metabolic syndrome and obesity. These are all the risk factors, or indirectly you can say these are the causes for NAFLD. Next slide, please. Obesity and fatty liver disease. It is directly linked, as obesity is nothing but, as you know, obesity is nothing but motapa, which means your body is supplemented with excess of fat. So definitely, if body is having fat, liver will also have fat. So indirectly, obesity and fatty liver disease are generally correlated. They go in hand together. Next slide, please. So what is diabetes and association of NAFLD? Okay, what we see, it is nothing but bidirectional. Means if a patient of having diabetes mellitus, he will have more prevalence of NAFLD. If a patient is having NAFLD, he will be having more prevalence of diabetes. That is, if a NAFLD patient, 2 to 4 fold of risk of developing diabetes, and if a patient is having diabetes, he has 3-fold risk of developing death due to cirrhosis. That is increased risk of NASH. Next slide, please. Symptoms of NASH, as we know, what are the symptoms of NASH? That is nothing but non, in which you will have upper quadrant pain, little bit of pain you will be having. You will be having obesity, decreased appetite. If it is little bit advanced disease, you may have pedal edema, you may have lethargy, not feeling of well sensation. These are the general signs of NASH symptoms. These are the symptoms of NASH. Next slide, please. What is diagnosis? How we diagnose? The main thing is, because the fatty liver is a silent killer, because the symptoms are very less. These are vague symptoms. Many of the symptoms are very mild. Patient will feel little abdominal heaviness, upper quadrant little bit pain. He will feel it is due to gas or these things. So it will cause to not diagnosis. Basically, NAFLD is dogs by the blood test. Main blood test is nothing but the liver function test, in which we see increase in the transaminases. That is nothing but SGOT, SGPT are elevated, in which the most specific is SGPT. Next is ultrasound. Ultrasound is non-invasive test, which is also known as sonography, in which we can see fatty liver. Next, advanced test, which is fibroscan. The advantage of fibroscan is it also detects fibrosis. Next is liver biopsy, and we'll have CT MRI in special conditions, which can be used. Next slide, please. So what I already told, what are the common tests? That is SGOT, SGPT. There is elevated ALT. That is ALT nothing but SGPT. ALT is more persistent. If it is elevated, it is problem. And but it is not that the patient with normal ALT can also develop progressive disease. It is nothing but the ALT normalism. Up to 80% of inability patients can have normal ALT level. So no designated ALT cutoff prediction of NASH or advanced fibrosis or NAFLD patients. Next slide, please. So what are the tests? These are various tests which can be used. That is, instead of AST, ALT alone, that is, these are the online calculators also available, in which we take age, AST, ALT, platelet count, that is FIB4, or we take NAFLD fibrosis score, in which age, AST, ALT, platelet count, BMI, fasting glucose, and albumin. This is the online calculators available. You can use this online and you can enter your detail, and you will be provided that how much risk factor is for your NASH and in what stage you are there. Next slide, please. So coming to non-invasive test, as I told, ultrasound, which is easily available everywhere. Ultrasound, what is it? It is most economic test, and in many of the times, patient goes for ultrasound for some other thing, and you find that he is having fatty liver. It is easily available, and only detects fat if it is more than 25%, but it will not differentiate between fat and fibrosis. Next slide, please. So coming to the fibroscan, which is also known as transient elastography, what I told is that it can diagnose fat if it is more than 10%. And next is it differentiate between fibrosis and fat content, and it is easy to operate. And some of the misinterpretation is that if in a many obese patient, if you're not using a proper probe, then it can cause a little bit of misinterpretation. Otherwise, it is a very good test, easily usable test. Nowadays, it is very popular test. Next slide, please. Okay, same what I told, that is nothing but transient elastography. Principles of transient elastography. We will have two scores, that is LSM score, which indicates the fibrosis, and next is CAP score, that is control attenuation parameter, which indicates the steatosis of the liver. This comes in a like the reading of LSM comes in 7.48, 8.49 like this, and CAP comes in 230, 40, 50. So these are many criteria in which we see the what is the normal range and the abnormal range depending upon the disease. We can differentiate easily if it is only fat or fibrosis is also associated with it. Next slide, please. This MRI, what I told, MRI is not widely used. It is costly test, but it is a gold standard test to detect fat content. It can also detect the measure if fat is more than 1% also. And it is basically used, this test is not used for diagnosis of patients in clinic. But yeah, if a patient who is going for a liver transplantation and he is a donor, then definitely this MRI scan is done because it will detect easily, because a patient who is having fatty liver will not able to a proper donor. Next slide, please. Now coming to invasive tests, these are rarely used before the development of fibroscan. Might be many patients were using liver biopsy, but the problem of liver biopsy is painful and it is individual dependent, and there are also chance of bleeding in it. Okay, and but it is what we say gold standard. Gold standard is liver biopsy, but it is not done very rarely. In 1 in 1,000 or 10,000 cases, we need a biopsy to make a diagnosis. If it is a NASH related, we generally don't do. If we are thinking it is associated with some other disease, then only we do. Next slide, please. Okay. Now coming to the this what does this flowchart detects? Basically, what is that? I told you these things. First is fatty liver. That is only isolated fatty liver. Next is with inflammation, which is known as NASH. That's after inflammation, NASH. NASH, if it is NASH for a long time, it goes into cirrhosis. If there is cirrhosis, it may be compensated or non-compensated. If it is decompensated, it goes into decompensation. Next, NASH patients can, after decompensation, can go into hepatocellular carcinoma, or directly they can go into hepatocellular carcinoma. So generally, what does the mean time is that coming to the cirrhosis, generally it takes 10 to 15 years, and for a malignancy after development of cirrhosis, 6 to 7 years. Next slide, please. So before we are already late, because when the patient goes into cirrhosis stage, before the cirrhosis stage, if we act, if we give the drugs, we give proper diet, then the patient can be cured. So only we say that severe NASH is not reversible. So before only we take the action. Action can be taken before, otherwise it will lead to a permanent liver damage. Next slide, please. So what is the treatment? Coming to the treatment, we'll talk about diet, exercise, lifestyle modifications, and new medications. These are the options which can be done. Next slide, please. So now coming to the basically weight gain. We should not have weight gain. So what we should do now, coming to the diet. Diet is nothing but you should have a low calorie diet. So that we take a low calorie diet, we should avoid our sugars, avoid our carbohydrates and fat, come to low calorie, do a proper exercise, and we should aim at body loss. We should have weight loss around 7 to 10%. If we then it will help in both improving the fat and fibrosis also. Next slide, please. So in this diagram, you can see what weight loss will affect. If you are having the steatosis, bulging inflammation, NAS resolution, these things, you can see in the chart typically if you have a weight loss of so much percentage, so you can reverse the things. So ideally what I say is patient, if it is severely obese, you take 10 to 20% of the weight loss, it's sufficient. The weight loss is more important. First thing is weight loss. Next slide, please. Now, what will come to diet? What I told already. Basically, you have to have with more of vegetables, fruits, whole wheat grains. You can use olive oil, beans, legumes, seeds, herbs, and spices. You can have, if you're non-vegetarian, fish. If you generally you should not have red meat and sweets, and you have eggs, cheese, and yogurt, which can have in moderate portions. So basically, low calorie food is this. This is a nice pictorial diagram to say how we keep our healthy liver. Next slide, please. Now, what I told already, exercises, we have to have both exercises, what is known as aerobic exercises, that is reduce the liver fat, it maintains health, improves cardiovascular condition, that is skipping, jogging, swimming, cardio, what we say, these are the aerobic exercises. Next is resistance exercises. What are the resistance exercises? It reduces the liver inflammation, it increases glucose sensitivity, glucose absorption, and improves metabolic parameter with less energy, that is weightlifting, what we say, weightlifting or push-ups, these things. These are comes under resistance exercises, so which will help in reduction of fat and fibrosis. Next slide, please. Basically, what are the lifestyle tips? Already we have told the risk factors. What are the risk factors? Like excessive fat consumption, low sugar consumption, these two. Then you should have small meals, you should have regular medical checkup, you should have proper vitamins and minerals, you should have enough sleep, and develop the exercise routine. You have to have a habit of develop of exercise and diet. This is the main treatment. That is, diet and exercise is the first main treatment of NASH. Next slide, please. Now coming to the pharmacological approach, that is nothing but the medicines which we can use. So these are the molecules you can see in the left side, that is pioglitazone, saroglitazar, and vitamin E. So pioglitazone, which one suggested minimum duration is 2 years. This generally pioglitazone is anti-diabetic drug. Also, a patient with diabetes with NASH, we can use this drug more common, which is helpful in both NASH and fibrosis patient, in both diabetic and non-diabetic patients. But generally, a diabetic patient, we can add this drug. Next, coming to saroglitazar, which can be used in both diabetic and non-diabetic patients, which is the most common and drug used nowadays. Now, coming to the vitamin E, which is also helpful in this, which can use in both adult and pediatric population. Next slide, please. Okay. Same thing. This is nothing but tips to prevent fatty liver disease. This is nothing but a repeat slide to indicate you again and again. These slides are being repeated so that you can understand. The main thing is not drugs. It is main thing is your lifestyle. So you should quit smoking, exercise regularly, limit your alcohol intake, take medications as prescribed, maintain healthy weight, limit consumption of refined carbohydrates. You have a balanced diet and limit intake of the saturated fats. Next slide, please. Okay. So you can also follow Nash 24/7. This is a very educative platform. You can understand digital platform in which many things about Nash you can understand easily. So you can follow this, which will help you to more educate and more understand about the disease. But the basic message what I have to give you is that without exercise, without diet, NASH cannot be controlled. That you see that I take a pill a day and my liver will be healthy. No, you have to do work for it. You have to keep your liver healthy. You also have to have give some time to your body and liver. That is exercise and diet should be proper. Next slide, please. Next slide. Well, already mentioned. This is nothing but a thank you slide. Thanks for the patience listening. Any questions any questions from the audience can be asked. I will ask the moderator if any questions they can put to me.
Thank you, sir. Thank you for this wonderful talk. This has enlightened us. Now we will take the question from audience. So there is a one common question is asked by the audience is that, sir, this fatty liver disease is age specific.
No, it is not age specific. The latest research from you can see many of the latest research are also saying that many of the school going children are also having fatty liver disease. That too, even urban and rural population are also having fatty liver disease. That is even a patient of village who is studying in a remote by village, or a patient who is studying in the tier one city. The schools, the study was conducted. They found that the every patient from the age group of 3 to 60, 70 years, all are having suffering from fatty liver disease. So it is not age specific, it depends upon your diet and exercise. Nowadays, children are eating more of the foods like processed foods, which is also a cause for this. The main thing of fatty liver disease nowadays is that is diet and less of exercise.
So there is a one question is asked by the Mr. Mukesh. He is saying that my mother is diabetic, and what type of the symptoms after that I have to consult the specialist.
Basically, first you have to understand that a patient is diabetic. So diabetic means she is having already having a risk factor to develop into a fatty liver disease. The main problem of fatty liver disease is that there will be no much specific symptoms of fatty liver disease. That if a liver goes into the inflammation and fibrosis state, then only you will have symptoms. The problem of liver disease is this thing. This is only the challenge because you don't have any specific symptoms. So basically, I will recommend that if it is a patient of diabetes, she should be screened by SGPT, which has been regularly done to the and ultrasound. If she is having SGPT high and ultrasound, then every diabetic should have a eye checkup. Every diabetic should have SGPT and ultrasound done. If it is ultrasound is showing fatty liver and SGPT is elevated, please consult a gastroenterologist or hepatologist nearby you because there will be no specific symptoms. Specific symptoms will come when the disease will progress. So you'll be having a little bit of weakness, which can be because of diabetes also. You will be having a little bit of nausea, vomiting, which can be because of diabetes also. So there is no specific disease, specific symptoms for fatty liver. So as you are a risk factor, get checkup done. And if it is costly, it is not a very costly test. SGPT hardly 100 rupees test and ultrasound 800 to 1000 in a place where I am staying easily can be done. So you have to consider.
So, so I think the question is asked by the patient. It is understood by them. So on behalf of Nest 24 by 7, sir, thank you for this lively and informative talk. So for the audience, as you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by the fatty liver to regularly visit doctors and continue medication. With careful observation and precaution, it is possible to obtain control of the disease. I would also thank to our audience for their active participation and patience in making this event successful. Stay connected with 20 Nest 24 by 7 on Facebook and take care of yourself and your family members. Thank you, sir. Thank you very much.